You're right. We're not in competition because I don't know if I would win. He's too good. So we're going to talk about influenza and pneumonia. And again, two questions should be on your mind. How big this is a problem and how serious. And when you talk about how big, it's the number of people, how prevalent it is, the rates, and when you're talking about how serious, what happens if this person contracts this disease? How serious is it on the long run? So influenza and pneumonia is, you're going to see the 8th leading cause of death in the U.S. And pull out your little infographic there. It's going to say the 7th cause of death in Clark County. So don't pay attention to the slide, but it is actually the 7th. So if you notice, 90% of flu deaths are persons over 65 and over. So in Clark County, males have higher mortality than females, and blacks have the highest mortality of all races. Again, the prioritization, when you look at interventions that would work, you pay attention to those subgroups. And look at the blue line, and look at the green line. If you notice, Clark County, they have similar immunization rates, and if we go to the next slide, you'll be able to see that the purple line and the red line, you see the similarities. You see where our target, which is the top line, is a healthy people 2020 target. We're way below average, and if you compare it to the influenza rates in the U.S., which is the dotted line, we're also below that. Go to the next slide, please. So each year, up to 36,000 deaths happen because of influenza and pneumonia. And if you notice, the economic burden is $83 billion here. So again, you look at two things: how big and what is the burden of how serious it is, the burden it gives to the societies. And if you one thing to note also is vaccinations are low and cost effective. So we're also trying to decide, which of these 7 is the one that we should focus on. Take into account this too. So we're going to talk now a little bit different. We're going to give the time to Sean, and we're going to talk about a different problem, like healthcare access.